Differences between an oxygen concentrator and an oxygen cylinder. An oxygen concentrator basically picks up oxygen from the ambient atmosphere and concentrates that and gives it to the human being at a percentage and concentration that humans need. An oxygen cylinder, on the other hand, is a refillable pressurized oxygen gas cylinder. So the difference between the two are twofold. Number one, an oxygen concentrator requires a regular power supply. In case you are in an area where power supply is erratic or you don't have power backup, an oxygen concentrator may not be such a good idea for you. Oxygen cylinder, on the other hand, does not depend upon power, but the cylinder needs to be refilled. So a cylinder that gets empty needs to be frequently refilled so that oxygen supply can be replenished. This is an oxygen concentrator. Because this is for home care, these instruments are easy to use. I just want to demonstrate how this machine works. The first component is the humidifier. This is attached to the top of the concentrator. You have to add some water to it so that the oxygen, when it goes inside, is humidified. That makes it easier for the lung to breathe. The oxygen concentrator is connected with a tubing. This is also known as an nebulizer aerosol kit. They come in two types. One is where you have a pipe connection, and at the end of it all, there is a nasal cannula. The nasal cannula goes into the patient's nose. The other type is the one with a face mask. Both perform the same function. The face mask is the one which goes around the patient's face so that the patient can breathe oxygen through the face mask. The one through the nasal cannula does the same function, except that the oxygen is attached to the nose like this and goes through the nose of the patient. The next component is the oxygen meter. So this particular cylinder tells you how many liters of oxygen is going into the patient per minute. And as you can see, the gauge has readings, and depending upon the requirement of the patient, you can adjust this particular gauge to increase or decrease the oxygen that is being taken by the patient. Give minimum amount that gives the patient benefit and brings oxygen up to acceptable levels like 92, 93, 94 SpO2, and that is good enough for the patient. The third and last component of the oxygen concentrator is the on-off switch. The on-off switch will enable all functions to start. So the way we do this is we fill the humidifier with water. As you can see, the assembly is very simple. You just take one end of the tubing and connect it to the humidifier, and the second end of the tubing goes in onto the patient's nose or face depending upon what connection you have. Once you switch on the machine, the oxygen will start flowing, and you can then use this to attach itself to the patient's nose. If you want, you can see whether oxygen is flowing. Once oxygen starts flowing in, you can adjust the number of liters of oxygen that goes into the patient, and within about 5 to 7 minutes you can start checking up the monitor to see how effective this is. अगर आपके पास घर में ऑक्सीजन सिलेंडर है तो ऑक्सीजन सिलेंडर को सही से कैसे इस्तेमाल करते हैं हम आपको एक बार डेमोन्स्ट्रेट करते हैं। इसमें दो कंट्रोल नॉब्स हैं, दो कंट्रोल वाल्व्स हैं। एक ऊपर ये पाना है, ये पाना ऑक्सीजन को कंट्रोल करता है, यानी कि ऑक्सीजन इस सिलेंडर में हाई प्रेशर में होती है, इसको धीरे से ये पाना रिलीज़ करता है। थोड़ा सा रिलीज़ करना है, टाइट नहीं रखना है और पूरा रिलीज़ नहीं करना है। थोड़ा सा जब आप रिलीज़ करेंगे तो ये आपकी ऑक्सीजन कंट्रोल वाल्व है जो आपको ऑक्सीजन गेज में बताएगी कितनी ऑक्सीजन अब आ रही है। ये हम ऑक्सीजन ऑन करेंगे तो ये जो ट्यूब है, जो ह्यूमिडिफायर है, इसमें हमने पानी भरा हुआ है। इस ह्यूमिडिफायर के थ्रू ऑक्सीजन निकल के ऑक्सीजन गेज से होती हुई हमको बताती है कि कितना ऑक्सीजन पर मिनट जा रहा है, 2 लीटर, 3 लीटर, 4 लीटर। और फिर हमने ये ट्यूब और पाइप कनेक्ट की हुई है। ये ट्यूब और पाइप, पिछली बार मैंने आपको नेज़ल प्रॉन्ग दिखाए थे, इस बार मैं आपको फेस मास्क दिखाता हूँ। ये फेस मास्क कान के ऊपर, मुंह के ऊपर हम ऐसे डालेंगे और इसको फिक्स करके रखेंगे और इस तरह से आराम से सांस लेंगे ताकि हम अच्छी तरह से ऑक्सीजन मेंटेन कर पाएँ।
With over 1 lakh medical experts and the facility to teleconsult, experience clinic-like consultations on Practo.